Good morning po to all our media partners. Lahat ng one at one ng nanonood sa ating DOH platforms, magandang umaga po. Welcome to our Kapihan session on the country's COVID-19 situation. I am Dr. Loradel Calio Renegado, Medical Officer 3 from the Office of the Officer in Charge of the Department of Health, your facilitator for today. Today, we have with us Dr. Alethea de Guzman, Director 4 of the Epidemiology Bureau, to give us updates on our country's COVID-19 situation. Joining her are our experts who have been with us since the start of our pandemic, of our COVID-19 response, Dr. Anna Ong Lim, Professor and Chief, Infectious and Tropical Disease in Pediatrics, UP-PGH, and Dr. Edsel Salvania, Director, Institute of Molecular Biology and Biotechnology, and UP-NIH Infectious Diseases Consultant as our panelists. Before we start our discussion, here are some house rules to ensure smooth flow of the session. To ensure the smooth flow of this session, everyone is encouraged to use the naming convention below for Zoom's username to ensure proper acknowledgement. To pay attention to the discussion of our health experts and resource persons,
Good afternoon. I think we're having a bit of technical difficulties with the audio of Dr. Laura, so I would be reading in advance. So to continue to ensure the smooth flow of this session, everyone is encouraged to 1, use the naming convention below for Zoom usernames to ensure proper acknowledgement. For example, name-organization/media outlet. Number 2, pay attention to the discussion of our health experts and resource persons. And 3, keep microphones muted while speakers are discussing and presenting. Now, number 4, should you have queries, participants shall signify and send questions in the Zoom chat box and wait for the host to acknowledge them. There shall be an open forum after discussions and presentations made later on. So submitted questions will be answered first by our experts, followed by Zoom chat box questions. So everybody is advised to send your questions in. And finally, only questions related to the topic discussed will be entertained. So let's please join the meeting and stay until the end of the program. So Dr. Laura, would you like to carry on?
can you hear me po?
Yes, loud and clear, Dr. Laura. Go ahead.
Thank you. Now, to start our discussion, please welcome Dr. Alethea de Guzman. Dr. Thea, good morning po.
Thank you, Laura, and good morning to our experts, Dr. Anna and Dr. Edsel, and of course, to our media partners. May I request that the slide be shared? Laura or Kim, will that be you or Sina Ange?
That would be us, Doc. We're pulling up the slides right now.
Sure. Okay, let's go on full screen. So for today, no, while this is entitled a COVID-19 national situationer, we'll actually be giving some updates on our metrics, as well as not just updates on our case and utilization data, but also our vax data, and especially no, ano yung ating gustong gawin moving forward. Let's go to the next slide. First, we'd like to share an overview of how our goals in managing this global pandemic have transitioned over time. At the start of the pandemic, the Philippines, like many other countries at that time, had the goal of eliminating COVID-19, aiming to prevent infection amongst the general population and an almost zero incidence or case data. With this, gatekeeping indicators such as surveillance, isolation, and testing were also taken into consideration. However, as this virus continues to mutate and evolve, as seen with the emergence of the Delta and Omicron variants of concern, we recognize that elimination of this virus itself may be a challenging goal. And this prompted us to transition our goals towards controlling the spread of the virus and reducing the number of people with severe and critical disease. That in turn reduces the load that we put on our health system as well as our deaths. We continue to revisit these goals and metrics in order to determine their relevance to the present COVID-19 situation, and from a focus in minimizing case transmission to prevent strain in our health, to now preventing strain in our healthcare system. We further shift towards strengthening our ability to reduce vulnerabilities by minimizing hospitalizations and deaths from COVID-19 by reinforcing our ability to respond through one, a robust laboratory and hospital referral capacity and network; two, increased availability of and access to treatment to manage cases; three, ramped up vaccination for both primary series and our boosters; and lastly, ensuring the establishment of functional disease surveillance units across all levels. Consulting our experts and our sub-technical working group members, we have acknowledged that our metrics should give a larger focus on levels of hospitalization, which is anchored on our central strategy to vaccinate and boost the population and the continuous upgrading of our hospital and critical care capacity. In line with this, the metrics that the Department of Health is putting more emphasis on is our admission, healthcare utilization, and vaccination coverage, while continuing our internal monitoring for case metrics such as our 7-day moving averages, 2-week growth rates, and positivity rates. Next slide, please. Previously, our strategy has largely centered around masking mandates, mobility restrictions, and vaccination. As more provinces, highly urbanized cities, and independent component cities meet vaccination targets, hospitalization and case transmission have remained at manageable levels, leading to looser mobility restrictions. Additionally, the achievements in vaccination has also led to the lifting of outdoor masking mandates across the country. Next slide, please. Google COVID-19 community mobility trends showed an increase in mobility in parks, groceries and pharmacy stores, retail and recreational areas, and transit stations, as well as our workplaces, with the reopening of classes with students and teachers going to and from work on a regular basis, as well as our and those employed. As we continually reopen sectors, we see mobility to further increase. With these increases, and as we slowly lift restrictions like masking, other interventions such as vaccination now play a bigger role to manage transmission and reduce hospitalizations and deaths. Next slide, please. As to vaccination, we observed, however, a slowdown in our vaccination uptake in the country. The number of fully vaccinated individuals represented by this blue line have remained at a plateau since we reached the 80% vaccination coverage of our target population. On the other hand, the Pinasrakas campaign
has led to some improvements in our booster coverages represented by the red line, now with around 26% of our target population being boosted. Next slide, please. In this graph, we'd like to demonstrate two things. First, the green shaded area showed that during the period of rapid vaccination coverage, despite the sharp increase in cases as represented by the blue line and during Omicron, the percent severe and critical among cases represented by this orange line were actually much lower at 16% of the total cases versus what was observed during the Delta peak, which was 25% of the total cases. However, in the recent spike of cases in August, here shaded in red, we saw a slowdown in this decoupling, which may also be due to the slowdown in our vaccination uptake. Data shows a plateauing trend of the proportion of severe and critical admissions among our COVID-19 cases rather than a continuous decline. As we continually lift restrictions and again, as mobility further increases, occurrence of cases and periodic spikes are inevitable, but vaccination will be central in ensuring minimal hospitalizations with severe disease as well as deaths. Next slide, please. Again, while we have reached our fully vaccinated coverage targets, our booster coverage is only at 26%. Among the 5 to 11-year-old, 50% of the target population is now fully vaccinated, but only 10% are boosted. Moreover, as seen on the right graph, only 30% of those aged 60 and above have actually received their booster shots, despite being among the first to have been permitted or given the authorization to receive these vaccines, which were in early 2021. Next slide, please. Lastly, looking at the proportion of severe and critical cases based or as per the different vaccination statuses, we see that still a higher percentage among the non-fully vaccinated individuals represented by the red line acquire severe and critical disease at 8.7% compared to the 5.7% among those who have been fully vaccinated. This data shows that vaccination continues to provide protection against more severe disease, especially among our vulnerable, which are the young and the elderly. Next slide, please. So where are we now as to our COVID-19 situation? Next slide, please. Testing data shows that the number of samples tested represented by the blue line has been at a decline over the recent months, with updated testing protocols resulting in widespread use of home-based antigen kits. Less people have been relying on RT-PCR confirmatory testing, and this has resulted to a larger number of undetected cases. It is important that individuals who test positive perform proactive measures such as self-isolation, as well as informing their close contacts in order to protect themselves as well as those around them. Next slide. Currently, admissions, including ICU and severe and critical admissions in the country, have been at a plateau after an increase in August 2022. Despite these admissions total and ICU bed utilization rates have actually remained at under 50% or at low risk. Meanwhile, on the right graph, a continuous upward trend in hospital admissions was observed among the non-COVID beds since February of 2022 and is also now on a plateau. Non-ICU admissions, which is the orange line, are at more than 70%, above its January level of under 60%. These increases in our non-COVID admissions may be due to a greater proportion of the population now accessing healthcare facilities for non-COVID conditions as they gain confidence to go out amid lower COVID-19 transmission rates. These demonstrate that our health system needs to put equal value to both COVID and non-COVID cases, as both can actually overburden our health system that may lead to increased complications and deaths. Next slide, please. These lower healthcare or low healthcare utilization rates were despite the case spikes that we experienced in August of 2022. Our positivity rate has slightly decreased from 15.1% to 15.1% from 15.2% last week. As previously mentioned, while we monitor positivity rates internally, this metric may be of less value as current behaviors and protocols on testing may be more biased towards testing of symptomatics, leading to higher detection of positive individuals among those tested, where previously a larger number of asymptomatics are the ones getting tested. With lower positivity rates, our case data shows that nationally, we reported 14,333 new cases from October 3 to 9, or an average of 2,407 cases per day, which is 10% lower than the previous week, which was at 2,285 cases per day. We remain at low-risk case classification with an average daily attack rate of 1.96 per 100,000 population. On the graph on the right, we see that cases in the National Capital Region represented by the blue line, as well as the rest of Luzon represented by the red line, are currently showing signs of plateaus after an increase, while Visayas, which is the teal line, maintained a plateau since early September. These plus areas, or the green line, remained on an uptrend since early September as well, while Mindanao, which is the orange line, saw slow but incremental increases in the recent weeks. As of October 9, NCR remains at moderate risk case classification. During the recent 1 or 2 weeks, we now see 7 regions, 3 from Luzon and Mindanao, and 1 region in Visayas showing case increases. The table also shows that despite these case increases in the recent 1 or 2 weeks, our total bed utilization rates have remained at low risk. Next slide, please. So now, where could we be given these situation and possible scenarios? Next slide, please. Our projection shows that a continuous decline in our minimum public health standards may lead to case increases. National daily cases projected using actual data as of September 18 show that cases detected at the national level are expected to follow a continuous, slow downward trend, with projections estimating cases at 1,204 cases per day by the end of October. However, a further decline in our MPH compliance may reverse our trend shown in the red and purple dotted lines, with an increase in cases ranging from 4,055 to as high as 8,670 by the end of October. Autumn projections also show a similar trend. However, it emphasizes that even with case increases, severe and critical cases are not seen to exceed those previously observed during the Delta and Omicron spike. However, with the emergence of a new variant, this may lead to a sharp increase in hospitalization at the beginning of 2023 in the National Capital Region. However, the effects of the emergence of a new variant that may be more transmissible or immune escaping may be minimized with vaccination, especially with our boosters, and also by prioritizing the elderly, which have a much higher risk for mortality. Next slide. And to end, we'd like to put across these key messages. First, as we now learn to live with this virus, it is important to minimize the risk for both hospitalization and death, especially among our vulnerable population. Second, the reopening of the economy entails an increase in our mobility and lifting of restrictions. But we can ensure that hospital admissions as well as utilization rates remain low by improving vaccination efforts and strengthening our healthcare and critical capacity. We must ramp up vaccination efforts to ensure that individuals, especially those most vulnerable, have up-to-date protection against severe disease and death. For children aged 5 to 11 years, they have the lowest full vaccination coverage across all age groups. And for the elderly, who have the highest risk for death, only less than a third have received their boosters. It is critical that in the next few weeks and months, we continue to increase full vaccination coverage, especially for these vulnerable populations. That's the end of the presentation. Thank you.
Thank you. Thank you very much, Dr. Alethea de Guzman, for the very comprehensive discussion of our country's current COVID-19 situation. We now open the floor for questions. Before we start the forum, maybe once again remind our media partners to please stick to the topics. We can have a fruitful discussion po. May we request our media partners to raise their questions in the chat box. Maraming salamat po. Also joining Dr. Alethea de Guzman in the panel are Dr. Ana Ong Lim and Dr. Edsel Salvania. Our first question is from Caroline Bongkin, and this is for Dr. Ana Ong Lim. Doc, is there an increasing number in COVID-19 cases among children and adolescents this September and October? How many are unvaccinated?
Thanks, Caroline, for the question. I can only share with you the experience that we have in the hospitals that I'm working with. I'm not sure if the team of Dr. Athea can give you specific numbers, no? But anecdotally, we did see an increase in numbers of admissions as reflected by an overcapacity in the number of beds that we were allocating for COVID, particularly in the Philippine General Hospital. Many of these kids were unvaccinated, either because they were younger than 5 years or they had not yet opted to be vaccinated. And as you will perhaps realize, the patient population that we serve in PGH are typically those who are vulnerable. So they have chronic illnesses, they're immunocompromised. So aside from the fact that they are in the younger age population, they also have these comorbidities that make them or that place them at risk for severe and critical disease. So overall, we did see more cases, and this is expected because there's more circulation in the community, coming perhaps from their family members as well.
Thank you very much, Dr. Ana. May we call on Dr. Thea po if we can provide figures po for the.
Thank you, Laura, and thank you, Dr. Ana. No, we'd like to actually affirm that there have been increases. Even in the prior spikes, what we observe is that kapag tumaas ang kaso overall, sinasabayan yan ng lahat ng age groups, even the younger population. But what our data is showing is ang contribution or yung proportion ng mga bata amongst all of the cases have not actually changed. So isabihin, though dumadami in terms of counts, yung laki ng mga kaso na bata ay hindi lumalaki. So parang hindi
naman nagkakaroon ng predilection na mas bata na o mas matanda na ang nakakasakit. Pare-pareho pa rin ang contribution. But again, like what Dr. Ana is emphasizing, that's where vaccination comes in. No? So we know that mababa pa yung vaccination amongst the younger population. And we need to push for vaccination because we don't want that trend to change. And we don't want to see a higher proportion of children now becoming the ones being admitted just because they're not getting the vaccination that is being provided naman or available to our population.
Thank you very much po, Dr. Thea.
Laura,
yes
sorry
po,
if I
Doc
can just
Ana.
add to that. I'm also reminded by data that was previously shared by the team of Dr. John Wong from Epimetrics. And unfortunately, among the pediatric population, there is a high rate of hospitalization and death in the most vulnerable population under the age of 1 year, if I'm not mistaken. So, aside from the consideration na syempre kailangan sana yung mga qualified na magpabakuna ay magpabakuna na, tandaan natin na itong mga batang to, wala pa kasing bakuna para sa kanila, yung below 5 years old. So kahit gustuhin nila, hindi talaga sila pwede kasi walang preparation that's available for them. So it's our role as the people in belonging to their households na pwedeng mag-qualify to be vaccinated, na tayo ang protection nila dahil hindi na tayo mag-uuwi ng sakit pa sa bahay. Thank you.
Thank you po, Dr. Ana. Another question po from Ms. Caroline Bongkin. What are the common symptoms of unvaccinated children who have recently got COVID-19? And also, how about those who are unvaccinated? Sa school po ba ang highest possible mode of transmission nila? This is for Dr. Ana po and for Dr. Thea.
Caroline, the symptoms of COVID among children are still typically very non-specific. Pwede talaga siya mapagkamalan like cough and cold illness or in some cases, fever and diarrhea. No? Kaya namin to alam kasi pag na-hospital sila, kailangan namin kasi silang i-cohort, which means we need to segregate them or allocate kung saan namin sila dadalhin. So kahit na yung presentation nila lagnat at pagtatae, matetest yan. At doon natin mahuhuli na, uy, my goodness, kahit na pala diarrheal illness ang presentation nitong batang to, COVID siya. No? So the message is, maraming ka-overlap ang symptoms ng COVID. Pwede siyang typical na respiratory illness, ubo, sipon, lagnat, pwedeng sore throat and lagnat, pwedeng sore throat lang walang lagnat, pwedeng nagtae walang lagnat, pwedeng nagtae may lagnat. So parehong maraming katulad. Kaya nga some of the clues that we have will be pag kumalat na yung sakit sa bahay, malamang sa hindi yung bata na hawaan din. At lalo na siguro kung may report yung parents na kahit mild illness lang sila or some other household members have mild illness, typically yung bata mahahawaan din.
Sige, Nora, siguro i-add ko and I'll validate yung sinasabi ni Doc Ana. I think she really is more familiar with what we're seeing naman. Just to also put across that, this parang hindi naman inconsistency, no? Kasi yung palagi nating ini-equate ang COVID na parang flu siya. Pero yung sinasabi ni Doc Ana na minsan cough and colds lang siya, sore throat nga lang siya, yun din ang nakikita natin even with other age groups. But I think yung emphasis sa bata kasi minsan hindi sila as expressive as the older age group. So mahalaga yung may naramdaman, aware tayo kung ano yung mas posible na maging sakit nila. At kung may pagdududa is magpatingin, no? So there are ways to consult either via teleconsult, either via hospital, and also even observing, tama si Doc Ana, no? Given that the circulating variant is more transmissible, when one person gets sick in the household, tapos mabilis yung hawaan and marami sa household mo or sa workplace mo ang naging may similar na pagkakasakit, and it's really likely na COVID siya. But I guess what's important to also note is yung sinasabi natin na isang first step is mag-isolate. At whatever age group, you get yourself isolated You seek consult as needed, access treatment as necessary and as may be prescribed by your physician din, no? So, yun na sa tingin ko yung one of the best ways natin to really live with this virus. It's not of getting adverse sa risk, but managing yung risk, no? And I guess yung anxiety natin doon sa pagkakaroon ng mga ganitong pagkakasakit.
Laura, I think I missed the second part of Caroline's question about school transmission, if I can address that. So Caroline, yung school transmission, of course we recognize na pwedeng mangyari yan. Katulad na lang din ng mga nangyari sa atin when we started going back to our workplaces and occasionally there were clusters. Pero siguro ang tatandaan natin, before school started naman for the areas that have already resumed face-to-face classes, nagkaroon naman ng maiging orientation yung mga school administrators about how to avoid transmission, which typically happens in the context of unmasked contacts. So kung meron man tayong aasahang transmission, it will probably be during meal breaks. Katulad na lang din na nakita natin sa sarili nating mga workplaces. So right now, I'm not aware of any reports of clusters coming in from schools. Hopefully, no, that indicates na we've been able to manage this pretty well. And of course, we're on the lookout for reports like that kasi yun talaga yung magpapakita na nagkaroon ng transmission within the school context. Pero so far, I'm not aware of any reports coming in in that nature. Thank you.
Yeah, can I add lang? I think the bigger issue here is meron talaga may infect kahit anong gawin mo, especially now that we're more mobile. And that's why to minimize that, vaccination minimizes that, boosting minimizes that, wearing mask minimizes that, good ventilation minimizes that. So we're not aiming for 100% prevention. Otherwise, hindi na lang talaga tayo magbubukas kung ganon. But we have to understand na ang children really their mortality is lower, but of course, there's also a lot more of them that are not vaccinated and boosted. And so we have to, as Ma'am Ana said, surround them with people who are properly vaccinated and boosted. Siguraduhin natin all the teachers, all the hospital employees are vaccinated and boosted. Yung mga classmates nila na pwedeng i-boost, boosted rin. And of course, yung paggamit ng mask, even if later on, sabihin nila, optional na, if we have crowded settings kasi mas mataas pa rin yung risk. And so the schools, on their own, as private entities, if they're not under the government, they probably should still consider continuing the mask mandate, at least in areas that are crowded. And these are, again, the mask mandate is not just a mandate that says na kailangan magtanggal ng mask yung mga tao. No, what it means is magiging optional pa. Pero if you want to be safer, definitely continue to wear your mask.
Laura, apologies, we're not hearing you well.
Dr.
Yes.
In relation to the previous question, they're asking if we have figures on the infection among children po.
Yes, we can share, but I'll read off, no? So, kasi the question kung ano yung proportion or dami ng pagkakasakit, as of October 9, we can see that those aged under 18 years old, no, yung pediatric population, is contributing just under 10%, no, doon sa total na kaso natin. That's the total. At kung titingnan natin yung mas recent na datos mula August 22 when we had that peak, no, yung spike ng cases natin, yung proportion na yun ay halos pareho lang, no? It's also just around 10.1%, no? Ito yung sinasabi natin na while there is an accompanying increase in the total number of cases when we see an overall spike in cases, meron ding pagtaas sa dami ng kaso ng mga bata.
yung contribution niya sa total na kaso ay hindi pa nag-iiba, no? Hindi siya markedly or significantly different. We'll share that data, Caroline, to the comms so that they can share it, no, to our media partners. Thank you.
Thank you very much po, Dr. Thea. Now for our next question po from Jasmine Romero of ABS-CBN. Are your expectations when face-to-face classes shall be fully implemented next month? This is for our experts po, Dr. Edsel and Dr. Ana, and also Dr. Thea po.
I can start siguro. Yeah. Yeah, I think na ano naman anytime you have any increase in mobility, you really expect an increase in number of cases. Pero kaya nga tayo nagbabakuna precisely because we want to make sure that our healthcare system is resilient. So, anytime we see a spike in cases, and na-mention na nga, di ba, a lot of these cases we're just picking up with antigen, hindi na napi-PCR yan, so hindi na nare-report. So, the same way that with endemic diseases like the flu, alam naman natin, hindi na natin talaga nakaka-capture lahat ng cases na yan. But the important point is yung impact on our healthcare system. And nakita na naman natin, we've opened classes since August and everything, hindi naman talaga lumalampas ng 50%. Actually, in some cases, kahit tumaas nga yung cases, bumababa yung healthcare utilization as a matter of fact. Just for me, right now I don't have any COVID cases in the hospital. I haven't had one in 2 weeks already. Because most people are really being managed at home, and people call me, but again, fully vaccinated, fully boosted, no problem. They do okay. Mas mababa rin yung risk nila of transmitting to other people. At some point, actually, all these isolation protocols might start to be relaxed as well, because yung risk of transmitting to other people with so many people being vaccinated also starts to go down. But that's also why we want people to continue to wear the masks, para can also think about whether how long talaga natin kailangan i-isolate yung mga tao. Mas tataas yung pagtanggalin natin yung mask. So very, very important to consider na yung overall risk versus benefit natin sa ating mga interventions is taken into account, because it will also enable us to do more.
Thank you very much po, Dr. Edsel. Dr. Ana?
I would agree with what Dr. Edsel said about an expectation about increased number of cases. Kasi, syempre, aasahan natin na mas mataas ang mobility, mas maraming interactions among people, which will result in more transmission. What I'm hoping to see is the continued decoupling. Pero, syempre, hindi ko rin maiwasang kabahan kasi nabanggit din ni Dr. Thea kanina medyo hindi ganun kaganda yung boosting uptake natin in the pediatric population. And also, I think we can still improve on our 5 to 11 primary vaccination rates. So sana, in anticipation of November, when full face-to-face classes will be implemented, yung mga magulang na hanggang ngayon hindi pa naaasikaso ang pagpapabakuna ng kanilang anak, i-prioritize na. Kasi syempre, kailangan din natin mabuo yung 2 dosis. Para dun sa 12 to 17, kailangan natin sila mabigyan ng booster at may panahon ding binibilang yun. Di naman bukas, pag natapos ka magpabakuna, protektado ka na. Diba? Thank you.
Sige, Laura, just to kind of summarize, what we'd like to put across is, as we open our classes, lalo na 100% na face-to-face yan, we somehow know what to expect already. This is what we saw when we lifted restrictions, when we opened our sectors, na may karampatang pagtaas yan ng kaso. Kasi magkakaroon tayo ng exposure and more contact with each other. Pero, yung gusto nating maiwasan ay ang mga bata ay nagiging admitted, nagiging mortality. Nandun papasok yung paghahanda na ginagawa natin. Kasi alam na nating tataas ang kaso. Alam natin posibleng may karampatang pagtaas ang admission. So gusto natin i-prevent yung ikalawa. Diyan pumapasok yung pagpapabakuna. Pero
Diyan din papasok yung pagbabantay na ginagawa ng mga magulang natin, ng school, so that we advocate for vaccination, and at the same time, di ba, may monitoring din tayong ginagawa sa mga eskwelahan natin, no? Doon papasok yung sinasabi na, ay, naghahanap tayo ng clusters of cases, naghahanap tayo na, uy, baka may kakaibang pagtaas ng mga absences. So lahat ng kailangan natin gawin to be in place as we open our year. We have mechanisms to do surveillance in schools. We are establishing connections between our schools and local government units so that there's referral either for testing, isolation, or further management. And andun, no, for, again, yung strategy natin ay yung pagpapabakuna. So we really hope that there's more uptake of vaccination among our younger age group. Pero dagdag po, sana din sa mga caregivers, no, at magulang natin, kasi meron nga tayong under 5 years old or 5 na hindi pa natin pwedeng bakunahan. So tayo yung magsisilbing pamamaraan para meron silang protection pa rin kahit na hindi pa sila eligible sa ngayon for any vaccination.
Thank you po. Thank you po, Doc Thea. Doc, this is still from Jacqueline Romero po of ABS-CBN. Maybe Doc Thea can provide us po of the profile of those who died and what are the
sige, Laura, mention na ka, pero I think, no, it's profile of those who died, no? So, katulad, I think, yung contribution ng total na kaso, yung mga nagiging mortality natin is still the same, no? So, overall, ang ating mortality is still among the much older age group natin, no? So, I'm just pulling up our data, no? Nakikita natin that cumulative, no? Kung babasihan ay ang total cases natin, ang may pinakamataas na case fatality rate pa rin ay ang mga pinakamatatanda, no? Amongst those less than 6 years old, ang case fatality is under 1%. No? So sabihin, hindi pa aabot ng isang kaso among 100 cases ang nagiging fatality sa mga under 60 years old. Pero once tumungtong ka ng 60 years old, nag-jump siya, no, to as high from as low as 5% to as high to 14.5%, no? So ganun kalaki yung risk for death among these much older population. So I'm talking cumulatively. No, but what's good, no? Ang nakita natin na pagbabago lang dyan ay in the recent months, no, as we reach better coverage, fully vaccinated coverage, nakita natin that while the risk for death is still higher among the elderly population, na-cut down na natin yung rate na yon. So kanina I was mentioned case fatality rates of HAS-I from 5 to 14%. Among our deaths from August to October 20 of 22, ang case fatality rates natin among the 60 years old and above has only ranged from 1.4 to 3.3%. So anong ibig sabihin? Mas malaki pa rin ang risk ng pagkamatay among the much older population. Pero dahil na-achieve na natin yung full vaccination coverage, dahil napapataas natin yung booster coverages natin, napababa na natin significantly yung risk of death, no? At kanina, yung pinakikita natin na datos, among those who are fully versus the not fully vaccinated, a larger proportion talaga of those who become deaths, I apologize, among those who are deaths are the not fully vaccinated versus the fully vaccinated. So itong mga datos na to, yung nagsasabi ng two things, kailangan magpabakuna tayo, no? Especially doon sa higit na matatanda kasi sila yung pinakamataas na tsansa na maging mortal.
Yeah, dagdag lang siguro, anecdotally, since I take care of patients, since January of this year, I have not had any young deaths. And actually, yung mga matatanda ko na above 70 years old, ang mga namamatay, yung mga unboosted. So very, very important po, especially for elderly, vulnerable population. Let's get them not just vaccinated, but boosted. alam natin darating na yung mga bagong bivalent vaccines at some point, so we really have to prioritize them. Kasi as Dr. Rafael has mentioned, below 60 years old, it's not so bad eh. Of course, we still want at least one booster in, and pag dumating yung mga bivalent vaccines natin, then we can also boost one more time kung sakali man. Pero priority po talaga, ang namamatay right now ay matatandang unvaccinated or unboosted. So if you're in that age range, please po magpa-boost na po kayo kasi ito po talaga yung nakikita nating namamatay. Thank you.
Nora, you're on show. We're not hearing you. Sorry. Sorry, still not hearing you.
Thank you very much po, Drs. Edsel and Dr. Thea. For our next question po, what is the rate of vaccination and how does the DOH feel about this? Maybe we can ask Dr. Thea po.
Sorry, Laura, I didn't watch what's the rate of vaccination.
What is the rate of vaccination po, Doc?
Sige, let me just pull up no. So, as of October 9, these are our figures, no? So, nationally, in terms of our fully vaccinated coverage, tayo ay nakaabot na no, ng 93.8% of our target population being fully vaccinated. Also, as of October 9, yung ating first booster coverage is at 25.78%. No? So, ito yung sinasabi natin na abot na natin yung fully vaccinated pero kailangan pa natin mapataas yung booster coverage. No? We'd also like to congratulate our regions, as most regions have actually been able to achieve that 90% fully vaccinated coverage ang may at I think as expected, no, pinakamataas na natin ay nakita natin sa NCR with more than 100% fully vaccinated coverage. At sila yung rehiyon no, na nakaabot ng first booster coverage na 51%. So we hope that our local government units, in partnership of course with the regional and national offices, yung iba't ibang settings natin, workplace, and yung non-traditional na settings kung saan tayo nagpapabakuna ay tuloy-tuloy, no? Kahit natapos na yung ating pinaslakas na campaign, ay tuloy-tuloy para maabot pa natin, no? Yung mas mataas na booster coverages natin across all our regions.
Thank you po, Dr. Thea. May we ask for the inputs on vaccination po from our experts? Dr. Edsel?
Yeah, I think very clear naman kaya tayo nakakaahon dito sa pandemya is because of our high vaccination coverage. And yung pinaka-important nga, yung sa boosting, especially for the vulnerable population and the elderly, there's really no, hindi siya rocket science. The more people we get vaccinated, the safer we all are. That's really the bottom line. And if you want to get out of this pandemic, from a personal standpoint, para safe kayo at safe yung pamilya natin, magpabakuna po tayo, magpa-booster. Huwag po tayo maniniwala sa mga chismis, lalo na dun sa mga problems with the vaccines and everything. If you look overall, there is nothing safer than getting the vaccine is thousands of times safer than actually getting COVID.
Thank you po, Dr. Edsel. Dr. Anna? Maybe you have additional inputs po.
Laura, siguro yung point lang na ine-emphasize nila Dr. Thea at saka ni Dr. Edsel regarding boosting. I think we have to understand that the newer data is actually telling us that the first 2 doses are, or rather having 3 doses, is significantly more effective against Omicron. And if we want to protect against COVID, parang we have to treat the boosters as part of the series. Baka kasi nasa isip natin, ay booster, pandagdag na lang. Pero ang data nagpapakita na kung gusto nating patuloy ang protection natin, we have to think about the boosters as an essential part of the complete series. So wag po natin sanang baliwalain.
Thank you very much po. Thank you very much po, Dr. to our experts. And now for our next question po from Dano Tingkungko of GMA. Just also want to clarify if bumababa na ang positivity rate in NCR and what it means for our prognosis in cases. There's also a related question from Jasmine. Should we be alarmed when other metrics as number of confirmed cases and positivity rate show an increasing trend? Should be considered a priority in looking at the data shared by the DOH?
Sige, Laura, I'll answer, no? So yes, no, we confirm that similar to the national trend, our positivity rate is already declining. Pero just to put into context, no, even before, now that we shift to putting more emphasis on admission and healthcare utilization, the DOH has emphasized that when we want to look at the COVID-19 situation, hindi tayo dapat nakapokus sa iisang metric lang. Not one metric will be able to fully describe the COVID-19 situation. We always triangulate these metrics para yung storya na binibigay natin ay buo, no? So, combination niya ng ano yung sinasabi ng kaso, ano yung sinasabi ng admission. So, to answer, ano ba yung nakaka-alarma? So, we don't want to alarm, but you're right, no? We want to, ang term namin, we're flagging certain things, no? So, pag tayo, ngayon, nagpa-flag tayo ng mga kaso, ang binabantayan natin ay tumataas ba ang kaso? Mayroon bang karampatang pagtaas ng positivity rate? Ako personally, no, the number of cases and its increase will almost always match a similar increase in positivity rate. So it's almost always telling a similar story, no? The trend is the same. Tataas ang kaso, tataas din ang positivity rate natin, no? Pero sabi nga natin, nakita natin that, you know, even in Omicron, when we reach that peak of, tama ba yung tanda ko, 35 cases on average, there's that decoupling na binabanggit natin kasi hindi sinabayan yung biglaang pagdami ng kaso natin ng biglaan ding pagdami ng mga na-admit natin. Ang laki ng gap, no? Kumpara nung Delta na parang kung gaano kalaki yung dami ng kaso, parang ganun din karami yung na-admit natin. Nung Omicron, hindi Kaya nakita natin na dati 1/4 of our cases are being hospitalized. Nung Omicron, that went down to as low as 16%, no? At ngayon, bumababa pa siya, no? Pero, kaya yun yung gusto nating bantayan. Kaya nating we can actually go through with another case spike, but dapat hindi siya sabayan ng malaki or similar spike in our admissions. That's number one. At ikalawa, hindi siya dapat sinasabayan ng pagkapuno ng ating mga ospital, nung tinatawag nating COVID-19 dedicated beds. The second one is very important. Hindi lamang dahil sa ayaw nating ma-overwhelm, dahil napupuno ang COVID beds, pero remember the graph we showed earlier na hindi lang COVID beds ang napupuno. Mas puno ang non-COVID beds po natin ngayon. Kung natatandaan yung risk natin sa utilization, high risk na siya, no? 70% of our non-COVID beds are actually utilized, no? As more people seek consult, get the procedures that they need that had to be done nung panahon na hindi kasi sila nakakalabas. So, ayaw natin na ma-burden siya, hindi lamang dahil sa marami ng non-COVID admissions, pero sasabayan natin ng COVID admissions pa. So, those two metrics we monitor, pero yung mas binabantayan at pina-flag natin is our admissions and our utilizations.
dagdagan ko lang siguro, when we first, nung ginamit yung positivity rate, wala pa po talaga tayong bakuna, and the only intervention we had was the number of tests that we could do. That was very early in the pandemic, and siguro wala nang gumagawa na noon, hindi China. Actually, kung gusto mo pababain ng positivity rate, madali lang naman yan eh. Mag-test ka ng mga ng mga walang sintomas, and that will actually increase your denominator. It will make it go down. But what is the point of that, 'di ba? Kasi kung maraming asymptomatics man diyan, what are you going to do in terms of an intervention? It's not going to change things. So the positivity rate is no longer a meaningful measure of anything at this point. Kasi tingnan mo, kung sa flu, di ba? Sino ba yung tinitest natin for the flu? People who are sick. And lalo na during flu season, naturally, mataas yung percentage na pick up mo. So, ganun na yung nangyayari rin sa COVID ngayon. In fact, a lot of the people that we test for RT-PCR probably already tested positive on antigen. And the reason we're doing it is because either magbibigay tayo ng gamot, ng antivirals, na because of the UA, kailangan may PCR, or number 2, kailangan natin mag-claim ng PhilHealth. Or number 3, yung iba, in denial lang talaga. Gusto nila makita na positive talaga yung PCR. So you're already selecting people who are already more likely to be positive. So it has already lost that meaning na dati gusto nila may adequate testing. Ngayon, it's not just may adequate testing tayo because meron namang self-antigen tests, but more importantly, ano ba yung magiging action mo dun sa positive na test na yon. So from at this point in time na marami nang nabakunahan, meron na tayong effective treatment, meron tayong self-antigen test, the positivity rate from RT-PCR is no longer that meaningful. Thank you po.
Thank you very much, Dr. Edsel. Now we are down to our last two questions po from Caroline Bonkin. Mas marami po ba ang unvaccinated na batang na-hospital ngayon dahil sa COVID versus those who have been fully vaccinated? And how is the data trend on COVID transmission among our healthcare workers? From Donna Pazibugan of Inquirer.
Sige, I'll answer that, no? Ang datos na meron tayo are among our admissions, no? So, anong nakikita natin? Sa mga admissions, aged 11 years old and below, 86% are not fully vaccinated, no? So, sila yung mga walang bakuna at all. While among those na 12 to 17 years old, almost 48% are the not fully vaccinated. No? So ito yung sinasabi natin na amongst our discharges, mas marami pa rin talaga yung mga not fully vaccinated natin. And I remember there's a graph earlier that we showed that kung overall age group naman, kung ikukumpara natin yung status nila, kung severe, critical, mild, moderate sila, yung proportion ng mga naging severe, critical at namatay among our hospital discharges, 2 times higher yung proportion na yon among our not fully vaccinated. It's around 5% among those not fully vaccinated who became severe, critical, and have died. Versus the just around 8%, no? Among those who have been fully vaccinated na, baliktad, sorry. 5% lamang po among those fully vaccinated have become severe, critical, or death. But among those who are not fully vaccinated, aabot siya ng beyond 8%. So there's still a higher risk among those not fully vaccinated na maging severe, critical, or death natin. And I guess to also answer yung second question, Laura, about our hospital healthcare worker data, nakita natin na noong tumaas ang kaso, yung overall increase ng kaso natin nitong Agosto, sinabayan din actually siya ng pagtaas ng mga kaso among our healthcare workers. So in July, before we had that spike, we registered 511 healthcare worker cases that went to as high as 901
in August of 2022. But now that we're also on a downtrend, nitong Setyembre, nakapagtala na lamang tayo ng 360 at nitong unang linggo ng Oktubre, it's down to 63 healthcare workers, no? We also saw some increase, no, the occurrence of some deaths among our healthcare workers in these spikes, no? And I think for me, that's a flag, no? Because mula ng nagsimula ang taon, nakita natin, no, ang healthcare workers natin, nagdo-double digits tayo. Pero starting February this year, nakita natin ang mga pagkamatay among our healthcare workers, bumagsak siya to just 6, no? Yun lang, gusto na maganda siya dahil kakaunti na lamang. Pero I think kaya ako nagpa-flag sa healthcare workers, they are the ones na may pinakamataas ng fully vaccinated coverage. Pero I think much like the other priority groups, hindi pa natin naaabot yung napakataas, no, na booster coverage. So we really want to zero down on the occurrence of deaths among our healthcare workers. It's so much less now, no? So iisa, may mga buwan tayo na wala tayong any healthcare worker death. But again, our vaccination played a big role. Now, like what our experts are showing, hindi na kailangan na nating dagdagan yung protection ng primary series. Mahalagang parte na ng protection ang booster so that these numbers that we're reporting now can really go down to 0 deaths, no? Especially for our healthcare workers na kailangang andyan, sila yung kailangan natin to ensure that there is continuous provision of direct service. Thank you, Laura.
Thank you po, Dr. Thea. And now for our last question po, for Dr. Edsel, do we see the end of the COVID-19 pandemic soon? When will it end po?
Yeah, so ang pandemic end actually ang nagde-declare niyan WHO, no? Pero nung September actually meron ng teaser si yung WHO Director General, sabi niya the acute phase of the pandemic seems to be ending, sabi yun ng WHO Director General, and they're meeting this October. So I wouldn't be surprised if sabihin nila na nandiyan na yung end ng acute phase. If not, after 3 months pa sila mag-meet ulit. But tingnan naman natin kasi hindi naman to ending na sasabihin ng tao, okay, tapos na, wala ng cases. Hindi, it's a gradual step down talaga. And we've gotten to this point nga na hindi na natin-threaten masyado yung ating healthcare system, hindi na napupuno, hindi na maraming taong namamatay, lalo na dun sa mga fully vaccinated and boosted, very, very little na lang talaga yung nagkakaroon ng severe disease. We look at the last 2 weeks, we reported 16,000-17,000 cases a week. Ilan ang severe? 2, 4, alam mo yun, it's a very, very small number. And usually yung namamatay, obviously yung severe, so it goes to show na yung mga namamatay, konti na lang talaga din. So, we're already near there. Kahit pa sabihin ng WHO, tapos bukas, meron pa rin cases na magtatransmit. Kailangan pa rin natin mag-ingat. Kahit sabihin nila na tapos na bukas, it doesn't mean that we don't continue to use the things that we know work against COVID-19. Ang ibig sabihin lang naman ng endemic or end of pandemic tapos endemic na siya is that we can manage, that we can predict kung ano yung magiging outcomes ng mga cases na to. It doesn't mean it's harmless. For instance, endemic ang dengue, endemic ang tuberculosis, marami pa rin namamatay every year. Pero at least predictable na, not to the point na magsasarado yung society natin na nagmimistulang parang bangungot nga yung last 2 years eh. Di ba, ngayon lumalabas tayo, hindi natin ma-imagine kung ano nangyari sa atin in the last 2 years. A lot of people are still processing that. But the truth of the matter is, ganito po talaga ang nangyayari sa mga pandemics. Eventually, they either fizzle out, kagaya ng mga SARS, ng mga MERS, or nagiging endemic sila, which is what we're going towards there. And nandun na tayo sa end stage. Kahit sabihin pa man ng WHO, hindi pa tapos yung pandemya, syempre ibang-iba na yung sitwasyon natin from 2 years ago. So we're getting there. And it's a gradual transition. Kaya kinakailangan natin mag-ingat. Hindi pwedeng basta, sige, tanggal na lang tayo lahat ng masks. You're gonna see a big spike, magkakaproblema ulit. there is a proper way to do these things. And the Philippines has been more cautious than most countries. And nakita naman natin, compared to America, na lampas 1 milyon yung namatay, mas maganda yung approach natin. So in that sense, I think whatever WHO decides, we really are on our way to getting out of this pandemic. And it's really just important to understand and to institutionalize the lessons of it. Yun lang. Thank you.
Laura, can't hear you again. Not.
Okay, this is another Laura of the DOH. I'd like to thank our guest speakers for today. And on that note, where we institutionalize the learnings from this pandemic, you're also all invited to another media kapihan on primary care naman po, or on Wednesday. But before that, may I ask Director Thea, Doc Ana, or Doc Edsel if they have final key messages for today po. Thank you.
Sige. Thank you, Laura. I'll start off, what I'd like to put across is this, this pandemic taught us to be flexible, to adapt, Kaya nakita din natin yung goal ng mga ginagawa nating response activity ay nagbabago. So from being very conservative and seeing that we want to zero out COVID-19 cases, we shift to we need to manage our cases. Now we're seeing, as we open sectors, as we become more mobile, as we lift restrictions, the increase in cases is actually inevitable. Mangyayari at mangyayari siya. Pero ang gusto nating hindi mangyari ay sabayan ng karampatan or equal na pagtaas ng admissions, hospitalizations, at deaths, Yung pagbubukas natin ng ating sectors, yung paglift ng restrictions, doon papasok yung halaga ng pagpapabakuna natin. At when we talk about vaccination, we're not just talking about primary series. The central strategy now is to complete your primary series, get yourself boosted, so that our protection against severe disease, especially for the young and the elderly who are at most risk and have the highest risk for mortality, is actually minimized. That's the key to us going out of this pandemic and being able to maintain the opening of our sectors and yung transition natin from this pandemic to an endemic to a better norm. Thank you, Laura.
Thank you po, Doc Thea. Next, Doc Ana.
Yeah, thank you, Laura. I think focusing naman on the needs of our pediatric segment, I just like to pick up on what Director Thea shared earlier regarding the vaccination and booster rates for our pediatric age group. So, alam naman natin na lahat tayo as adults na kinabang nung nagpabakuna tayo. Natatandaan ko this time, 2 years ago, nung nagkaroon ng marami sa atin ng sakit, ang kaba natin noon, malalagpasan ba natin to? Maililigtas ba yung buhay natin? Pero ngayon, kung meron tayong kakilala nagkasakit, ang tinatanong na lang natin, hanggang kailan ka ba mag-isolate? Pwede na ba tayo magkita next week? Hindi na natin halos iniisip na madidisgrasya sila. And that's really because we are vaccinated. So dapat ganun din sana yung advantage na maibigay natin sa ating pediatric population. Yung ating mga kabataan na pwede nang bakunahan at pwede nang maboost, sana wag natin silang pagkaitan ng pagkakataon na sana ganoon din yung experience nila na hindi tayo kakabahan na madidisgrasya sila dahil nahawaan sila. Dahil sa lagay ng sakit na to ngayon, ang galing-galing niya makahawa, mahirap talagang umiwas. So what we're after is providing them with the same protection that we are all used to now as adults. And lalo na in the context na magbabalik na talaga lahat sa school, lalong dapat na bigyan ng panahon, bigyan ng atensyon ng pagbabakuna ng mga bata. Thank you.
Thank you po, Dr. Ana. Next, Dr. Edsel po.
Yeah, I think that's a good theme na yung sinasabi nga ni Ma'am Ana na we've already gone from dati mamamatay ba ako to hanggang kailan ba ako nito ga-isolate. Pero even that actually still has an impact. Isipin po natin, lalo na dun sa mga less fortunate brothers and sisters na kababayan natin, pag nahawa sila, hindi sila makakatrabaho kasi nag-isolate sila. So may impact pa rin ito and there's an outsized impact lalo na sa ating mga kapatid na masa. And so for all of us, parang masakit na rin natin yan na yung pagdidisiplina natin, paggamit natin ng mask, pagtitiwala natin sa bakuna na mapoprotektahan tayong lahat and we can continue to keep our society open, keep our economy open. And like I said, yung isolation na yan, that's also dependent on level of vaccination. In fact, in other countries, ang sinasabi na lang nila, okay, nag-positive ka, hindi na nga sila nag-isolate Sinasabi nila mag-mask ka na lang 5-7 araw, ganon. So, hopefully makarating rin tayo doon na naprotektahan na natin yung vulnerable population natin para at some point, pati yun, iisipin na natin na magiging endemic na talaga siya at yung impact sa ating mga kababayan, lalo na yung mga no work, no pay, very important we also have to consider na itong pag-isolate and everything, mawawala yung risk or at least bababa yung risk na kakailanganin pa natin gawin ng mga bagay na to pag nagpapabakuna tayo at patuloy po yung paggamit natin ng mask. Thank you po.
Thank you very much, our dear experts, and to all of our media partners. That concludes our Kapihan session for today. Maraming salamat po sa patuloy ninyong pagsuporta sa kagawaran ng kalusugan sa pamamagitan ng pagbabahagi ng tamang impormasyon sa publiko. Sa bawat one at one ng nakasubaybay sa talakayang ito, patuloy po tayong magkaisa at magtulungan upang matamasan natin ang mas magandahawang buhay. Patuloy po tayong sumunod sa minimum public health standards at higit sa lahat, magpabakuna po tayo not only to protect ourselves but also our loved ones. Lagi po nating tatandaan, ang taong may disiplina at may tiwala sa bakuna, may malasakit sa masa. See you po in our next Kapihan session. Maraming salamat para sa Healthy Philippines.
Thank you to our experts.
Thank you po.
Thank you.
Thank you, Doc Thea, Doc Ana, Doc Edsel. Thank you po.